are going to be doing shoulder abduction, manual muscle testing from 5 to 2 plus. The client is going to be seated, shoulder adducted, elbow relaxed, and forearm in neutral with the palm facing the trunk, just like that. Next, I am going to stabilize the shoulder being tested, in this case the right shoulder. I'm going to palpate the middle deltoid, right down the middle. And I'm going to ask the client to raise their arm laterally. There we go, like that, midway. And stop, and I palpated the middle deltoid. And now I'm going to apply resistance to the distal end of the humerus, right here. I'm going to tell the client that at the count of 3, I'm going to try to push down, and you have to stay up, okay? In her doing the movement, it lets me know that she's already at least 3. Full range of motion, against gravity, no resistance. Now I'm applying that resistance again at the distal part of the humerus. So ready? 1, 2, 3, and 3 plus, 4, and 5 with min, mod, and max resistance. Okay, and now 3 minus would look like if she did the motion more than half of the range of motion and plop down, and 2 plus would be less than half of the range of motion and plop down with, of course, no resistance. This is shoulder abduction, manual muscle testing for 2 plus to 0 with gravity eliminated. So the client will be in supine, shoulder adducted, elbow relaxed, forearm in neutral, and palm of the hand facing the trunk. I'm going to stabilize the shoulder being tested. I'm going to palpate the middle deltoid, and I'm going to ask the client to reach her hand out. Let's set a bit, good, just like that, palpated. And now I am going to, just in seeing that, I can see that she is at least a 2, which is full range of motion, no gravity, no resistance. Now I am going to apply some resistance in the distal part of the humerus, and I'm going to push it down, and I'm going to tell the client to not let me at the count of 3. So 1, 2, 3, and I'm only going to apply minimal resistance. That lets me know that she's at 2 plus, which is full range of motion, no gravity, min resistance. Now 2 minus would look like less than full range of motion, right? And then no resistance, and then 1 would look like a twitch in the muscle, and then 0 would be flaccid. Okay, we are going to be doing shoulder external rotation, manual muscle testing from 5 to 2 plus. So the client is going to be in prone, shoulder abducted to 90, elbow flex at 90, and the forearm in neutral, hanging over the edge, perpendicular to the floor. I'm going to stabilize right here at the distal end of the humerus. I'm going to palpate along the axillary border, right, for the teres minor. And then I am going to instruct the client to try to touch the ceiling with the back of her hand. There we go. And that lets me know she's at least a 3, full range of motion, against gravity, no resistance. Now I'm going to change my stabilizing hand so I could apply resistance to the distal end of the forearm. And at the count of 3, I'm going to try to push it down, okay? And you stop me, okay? 1, 2, 3. And that lets me know that she is at 3 plus, 4, and 5, so min, mod, and max resistance. Okay, and now 3 minus would look like if she did the motion, which more than half of the full range of motion and plop down, and 2 plus would be less than half of the range of motion and plop down, of course, with no resistance. Okay, we will be doing shoulder external rotation, 2 plus to 0, so with gravity eliminated. The client is going to be seated, shoulder adducted, elbow flexed at 90, and the forearm in neutral. I'm going to stabilize here at the distal end of the humerus, and I am going to palpate on the axillary border of the scapula for the teres minor, and I'm going to tell the client to rotate her arm away from her body. There we go. And now that lets me know that she's at least a 2, full range of motion, no gravity, no resistance. Now I'm going to apply resistance at the distal end of the forearm, and I'm going to push it towards the body. You have to keep me from doing that, okay? At the count of 3. So 1, 2, 3, and it's minimal resistance. So that lets me know that that's a 2 plus. So full range of motion, no gravity, min resistance. And now 2 minus would look like if she did the motion at least less than the full range of motion, but would plop down. And then 1 would be if she did the motion and she just twitched, and 0 would be flaccid. Okay, so we will be doing shoulder internal rotation manual muscle testing from 5 to 2 plus. The client will be in prone, shoulder abducted to 90 degrees, elbow flexed at 90, and the forearm hanging in neutral off the edge of the bed, perpendicular to the floor. I'm going to stabilize at the distal end of the humerus. I am going to palpate the teres major, this time along the axillary border of the scapula. And now I'm going to tell the client to rotate the arm away from the body, downward. Okay, there we go. And now I am going to apply resistance at the distal end of the forearm, and that lets me know that she is at least a 3 because she completed the movement. So full range of motion against gravity, no resistance. Now ready? 1, 2, 3, hold. That lets me know that 3 plus, 4, and 5 with min, mod, and max resistance. And now what 3 minus will look like is if she did the movement, right? More than half of the range of motion, but she would plop down. And then 2 plus, less than half of the range of motion and plop down, and no resistance, of course. Okay, we are going to be doing shoulder internal rotation manual muscle testing from 2 plus to 0. So gravity eliminated, therefore the client is seated, shoulders adducted, elbows flexed at 90, and forearm is in neutral. I'm going to stabilize at the distal end of the humerus. I'm going to palpate for the teres major at the axillary board of the scapula. I'm going to now instruct the client to touch her stomach. Good. Now that lets me know that she's at least a 2 with full range of motion, no gravity, no resistance. Now I will apply resistance to the distal end of the forearm, right? And I'm gonna let her know to try to keep her hand in her stomach while I try to pull away. Okay? So at the count of 3, 1, 2, 3, and that lets me know that she is minimal resistance, a 2 plus, full range of motion, no gravity, min resistance. Now what a 2 minus would look like is if she did the motion of internal rotation, which is less than full range of motion, and then plops down. And then 1 would be if she tried to do the motion and she would just twitch, and then 0 is flaccid. We are going to be doing manual muscle testing of wrist extension with radial deviation from 5 to 2 plus. So the patient is going to be seated, shoulder adducted, elbow flexed, wrist in forearm in pronation, and wrist in neutral. Now I'm going to stabilize over the mid forearm at about around mid forearm, proximal to the wrist. I'm going to palpate the extensor carpal radialis longus and extensor carpal radialis brevis at the base of the 2nd and the 3rd metacarpal. And now I'm going to ask the client to move diagonally up and towards the thumb. There we go. Up and towards the thumb. Up and towards the thumb. Okay, good. And that lets me know that she's at least a 3, which is full range of motion against gravity, no resistance. Now I am going to apply that resistance diagonally down, so towards flexion and ordered deviation. So I'm going to, at the count of 3, I'm going to push you down the opposite way and you try to resist me, okay? So 1, 2, 3, good. So 3 plus, 4, and 5, meaning min resistance, mod resistance, and max resistance. Now what 3 minus would look like is if she did the motion and it would be more than half of the range of motion and she would plop down, and 2 plus is she did less than half of the range of motion and she would plop down. Okay, we are going to be doing wrist extension with radial deviation from 2 plus to 0, so with gravity eliminated. So therefore the client will be seated, shoulder adducted, elbow flexed, forearm in neutral. So the ulnar border of the forearm will be touching the table, and wrist is in neutral. Next, I will be stabilizing proximal to the wrist. I'm going to palpate extensor carpi radialis longus and extensor carpi radialis brevis at the dorsal aspect of the wrist at the base of the 2 and 3rd metacarpal right here. Now I'm going to instruct the client to go back and up towards the thumb. There we go. Good. That lets me know that she's at least a 2, which is full range of motion, no gravity, no resistance. Now I'm going to resist at the count of 3. I'm going to let her know I'm going to resist the opposite direction, diagonally down. Okay, so I'm going to resist right here at the dorsum of the 2nd and 3rd metacarpal. Ready? So 1, 2, 3, and it's going to be min resistance. So that lets me know that it's a 2 plus. So what a 2 minus looks like would be if she did that motion, and it would be less than full range of motion and she would plop down. Well, 1 would be is if I told her to do it and she would do it and she would just twitch, and then 0. Okay, we are going to be doing wrist flexion with radial deviation from 5 to 2 plus. So the client is going to be seated, shoulder adducted, elbow flexed, forearm in supination, wrist in neutral, fingers relaxed. So I'm going to now stabilize at about the mid forearm, proximal to the wrist. Next, I am going to palpate over the flexor carpi radialis tendon at the base of the 2nd metacarpal. Right here. Now I'm going to instruct the client to go up and towards the thumb, up and towards the thumb. There you go. Next, I am going to apply resistance. But before that, in her doing that motion, I know that she's at least a 3. Full range of motion against gravity, no resistance. Now I'm going to apply the resistance in the opposite direction, so towards extension and ulnar deviation. So you try to keep it that direction, right? 1, 2, 3, good. 3 plus, 4 and 5, so min, mod, and max resistance. Now, what a 3 minus would look like is if she would try to do the motion and go more than half range of motion and plop down, and 2 plus would be less than half the range of motion and plop down. Okay, we are doing wrist flexion with radial deviation from 2 plus to 0. So that means gravity is eliminated. Therefore, the client is seated, shoulder is adducted, elbow is flexed, forearm is in neutral position, meaning the ulnar border is touching the table. Wrist is in neutral. Now I'm going to be stabilizing proximal to the wrist. I'm going to be palpating for the flexor carpi radialis tendon at the base of the 2nd metacarpal. I'm now going to observe my client move the wrist forward and up towards the thumb. Good. And now that lets me know that she's at least a 2, which is full range of motion, no gravity, no resistance. Now I am going to do resistance in the opposite direction, so towards extension and ulnar deviation, and you have to keep me from doing that. Okay, so try to stay locked in that position. Okay, and I'm going to apply resistance, and it's only going to be minimal resistance because she's a 2 plus, so it is full range of motion, no gravity, minimal resistance. Now what a 2 minus would look like is if she did less than full of the movement, less than full range of motion, and just plop down. And then 1 would be if I told her to do it and she would just twitch her muscle, and 0 is flaccid. For this video, we're going to do MCP flexion, MMT, from 5 to 3 for the purposes of class, just 5 to 3. So the client is going to be positioned seated, forearm resting on the table in supination, shoulder adducted, elbow flexed, forearm in supination, wrist in neutral. I'm going to stabilize proximal to the MP joint in the palm of the hand. I'm going to palpate the first dorsal interosseous muscle between the medial and distal aspect of the 2nd metacarpal and the dorsum of the hand. So right here, just to show the video, right there. And now I am going to tell my client to flex this finger, this one, there we go, right there. Okay, And now in her doing that movement, it lets me know that she is at least a 3 for range of motion against gravity, no resistance. Now I am going to apply resistance between the MCP and PIP joint towards extension. It should be right here. And she is going to try to stop me from doing that, okay? 1, 2, 3, and she 3 plus, 4, and 5. Okay, so that lets me know that she has resisted min, mod, and max resistance. Now okay, I'm going to do PIP flexion, MMT. For the purpose of this class, we're only going to do from 5 to 3. The patient therefore is going to be seated, shoulder adducted, elbow flexed, forearm in supination, wrist in neutral, MPs and IPs extended. Next, I am going to stabilize between the MP and the PIP joints right here. Since there's no space, I could use the same finger to stabilize and palpate. I'm going to palpate the flexor digitorum superficialis at the volar surface of the proximal phalanx. And now I'm going to make sure that the client puts her finger up. So we're doing 1 digit at a time, and I palpated the flexor digitorum superficialis. In her doing that movement, she lets me know that she's at least a 3 for range of motion against gravity, no resistance. Now I am going to resist between the PIP and the DIP, and she's going to try to hold me down at the count of 3. Ready? 1, 2, 3, and that's 3 plus, 4, and 5 lets me know that it is min, mod, and max resistance. Okay, we are going to be doing DIP flexion MMT from 5 to 3 for the purpose of this class. The client is going to be with the shoulder adducted, elbow flexed, forearm in supination, wrist in neutral, MPs and IPs extended. I am going to stabilize between the PIP and DIP joints. I'm going to palpate for the flexor digitorum profundus. Because there is no space, I could palpate and stabilize at the same time. So I'm going to now observe the client flex the tip of her finger, just like that. And I'm palpating for the flexor digitorum profundus. Now in her doing the movement, she lets me know that she's at least a 3, which is 4 range of motion against gravity, no resistance. Next, I'm going to apply resistance at the distal phalanx right here. And at the count of 3, you try to keep it up, okay? 1, 2, 3. 3 plus, 4, and 5. So it lets me know that she has resisted min, mod, and max resistance.